So what we're doing here is using a device called the Infini. And the Infini uses microneedling technology combined with radio frequency technology. And it's important that we use that combination because while microneedling can have some very good effects, sometimes we want to have more benefit. We want to have more skin tightening. We want to generate more collagen, more elastic tissue. And the way we do that is by causing a greater injury. And that's why this particular treatment requires numbing cream. But what happens is these small little microneedles enter the skin. As they enter the skin, at the very tip of each little microneedle, which is about 200 microns, it generates heat. And that heat is a wound that your body has to heal from. And as it heals, it brings in new collagen and new elastic tissue, one, to plump up the skin and to create new collagen, but two, to tighten the skin. And that's something that we weren't able to do before with microneedling alone. And that's why this is a really unique device. This is not a laser, it's actually an energy device. And one of the benefits of that is that it can be used on all skin types. And typically, depending on each patient, I'll start with the areas that bother them the most and focus on areas that need more attention. But I adjust, there's no cookie book answer here. I adjust at each parameter and the number of times I have to treat someone for each patient, and I individualize that. For a little pressure. How was that?
That was wonderful.
That's the hardest part. It doesn't hurt any more than that.
Nope.
It's more the noise than anything else. And as the patient's more comfortable, you pick up speed, it becomes easier and easier. And what we end up doing is multiple passes of this technology over time. Typically around 3 passes per treatment area. And what I do is I adjust the depth of the needles so that I can target specifically the individual complaints. Some people have acne scars, and when people have acne scars, the needle depth has to be much deeper than someone who has just thin skin on the neck and has some crepey skin on the neck, and we want to tighten that. So each patient gets a different treatment to optimize the results.